Sir, you can start.
Okay, welcome student. Today we see the topic disorder of the CNS system. Okay, the central nervous system is very important because it's a main part in our body. Okay, so this maximum time exam में CNS question आते हैं. So we'll see first anatomy and physiology of the central system. Briefly we'll see. We know will be a brain, will be a central part, and middle part will be a spinal cord. Okay, in the brain we have lobe, frontal lobe, parietal lobe, temporal lobe, occipital lobe. Then we have midbrain, pons, medulla, cerebellum, brainstem. This all have different function. सबका अपना function होता है, and the function से हिसाब से they will do activity. And the all thing जो भी हमारा decision होता है वो will be done by the central system. And पेगोनल system क्या करता है, उसको supply करता है, like somatic में और autonomic में. Okay, so one will be given to the vein and one will be taken from the artery. So what is autonomic? Autonomic means example you want to pick up pain. आपको pain pick up करना है तो आपने brain को बोला, okay, and brain will tell now pick up the pain. So somatic हो गया. autonomic मतलब क्या है, आपका पेरिफेरल पार्ट से ब्रेन तक जाना, और सोमेटिक मतलब क्या है, ब्रेन टू आपका पेरिफेरल पार्ट में जाना, क्या फंक्शन. ओके, तो ये ब्रीफ हो गया हमारा एनाटॉमी एंड फिजियोलॉजी ऑफ द दिस थिंग. सो ब्रेन एंड सेंट्रल ब्रेन आपका सेंट्रल सिस्टम पार्ट है, पेरिफेरल पार्ट कौन सा है, स्पाइनल कॉर्ड. ओके, नाउ विल सी द नर्व. इट्स वेरी इंपॉर्टेंट थिंग बिकॉज़ मैक्सिमम डिजीज कंडीशन आपकी जो है वो आपके नर्व से बनती है. सो यू कैन सी द न्यूरॉन्स नाउ. ओके, नाउ न्यूरॉन विल बी, वी हैव डेंड्राइट्स. ओके, इसको डेंड्राइट्स जो आपका आगे जाके एक्सॉन से कनेक्ट हो जाएगा. यू कैन सी एक्सॉन हियर, आपको एक्सॉन दिख रहा है यहाँ पर, विल बी कनेक्ट विद एक्सॉन फ्यूचर में. ओके, तो यहाँ पर आपका एक्सॉन होगा. तो डेंड्राइट एक्सॉन क्या करता है, सप्लाई करता है नर्व को. ओके, एंड देन दिस आर सेंटर पार्ट. ओके, द सेल बॉडी. देन सेंटर पार्ट में क्या विल बी न्यूक्लियस. ओके, न्यूक्लियस. ओके, एंड विल बी नेजल बॉडी आल्सो विल बी देयर. ओके, एज अ पॉइंट होगा क्या जानना है कि इसका पार्ट्स का नाम क्या है, एक्सॉन. ये एक्सॉन है और इसका जो पैरेलल पार्ट है वो डेंड्राइट से, और डेंड्राइट और एक्सॉन आपस टचअप करते हैं. ओके, देन वी विल सी दिस स्ट्रक्चर. ओके, स्ट्रक्चर ये क्या है आपका, यहाँ पर आपका आता है, इसको बोलते हैं माइलिन शीथ. दिस कॉल्ड माइलिन शीथ. एंड दिस जो आपको बीच में स्पेस उसको बोलेंगे न्यूरोलेमा. ओके, न्यूरोलेमा. सो न्यूरोलेमा विल बी द कवर. once I show the picture you can see here, जो आपका येलो येलो जा रहा है बीच में वो उसके क्या बोलते हैं हम, न्यूरोलेमा. ओके, और जो कवर कर रहा है उसको क्या बोलते हैं, माइलिन शीथ. ओके, और जो माइलिन शीथ के बीच में जो और उसको क्या बोलते हैं, नोड ऑफ ब्रेनविल. नोड ऑफ ब्रेनविल. ओके, सो इसका मीनिंग क्या है, नोड ऑफ ब्रेनविल. दिस थिंग जो हमारे इंपल्स हैं, जो डेंड्राइट और एक्सॉन टचअप करके जो आने वाले सप्लाई करना है आगे, तो ये इंपल्स सप्लाई होने के लिए ये क्या करता है, आपके फास्ट सप्लाई करता है. फास्ट मूवमेंट ऑफ द डेंड्राइट और एक्सॉन विल बी देयर. ओके, तो उसके लिए क्या होता है, we need axon. So axon क्या सप्लाई करेगा, तो जो न्यूरोलेमा है वो नर्व सप्लाई करने पार्ट काम करता है, और जो आपका माइलिन शीथ है उस सप्लाई को बढ़ाता है, इंक्रीज द पल्स प्रेशर. मतलब जो भी आपका इंपल्स है उसको फास्ट भगाने के लिए वी रिक्वायर न्यूरोलेमा. ओके, एंड जो जिसको कंट्रोल करने के लिए ना पल्स ज्यादा हो जाएगा क्या होगा, सीजर एक्टिविटी. सो कंट्रोलिंग द इंपल्स को कंट्रोल करने के लिए फास्ट मूवमेंट नहीं करे तो उसके लिए नोड ऑफ ब्रेन भी चाहिए. सो आई विल वंस अगेन के लिए बहुत इंपॉर्टेंट थिंग याद रखना, क्योंकि इससे बहुत ही डिस्कशन बनेगी. ओके, तो न्यूरोलेमा क्या है, जब कोई येलो ट्यूब दिख रही है, येलो कलर लाइन दिख रहा है, वो न्यूरोलेमा है. और जो आपका ब्लूइश कलर कवर कर रहा है उसको बोलते हैं माइलिन शीथ. ओके, देन जो आपका माइलिन शीथ के बीच में जो स्पेस उसको बोलते हैं नोड ऑफ ब्रेन भी. तो ये न्यूरोलेमा सप्लाई करता है इंपल्सेस, और जो आपका माइलिन शीथ कवर करता है और सप्लाई इसको इंपल्स को फास्ट करने के लिए माइलिन शीथ चाहिए, और इंपल्स को कंट्रोल करने के लिए ज्यादा फास्ट नहीं हो जाए उसके लिए नोड ऑफ ब्रेन भी चाहिए. अदरवाइज अगर आपका सीधा स्ट्रक्चर होता तो क्या होता, इंपल्स विल गो वेरी फास्ट, देन पेशेंट हैव अ कंटीन्यूअस सीजर. दैट्स व्हाई वी रिक्वायर नोड ऑफ ब्रेन भी. देखो नोड ऑफ ब्रेन भी है, नोड ऑफ ब्रेन भी विल बी एवरीवेयर इन द माइलिन शीथ. ओके, सो ये हमारा हो गया. एंड this will be a swan cell also there. Okay, हम इधर डिटेल में नहीं जाएंगे, but we'll see these are the structure will be required. Now we'll see first topic, CVA, cerebrovascular accident. CVA बहुत से टाइम पे इसके बहुत से आते हैं, तो आई टुक फर्स्ट थिंग. ओके, CVA, cerebrovascular accident. इसका दूसरा नाम क्या है, ब्रेन अटैक या स्ट्रोक भी बोलते हैं. इसको क्या बोलते हैं, ब्रेन अटैक या स्ट्रोक भी बोलते हैं. So the other name is a brain attack and stroke also other name will be have. Now what is definition, destruction of the brain cell. due to reduction of cerebral blood flow and oxygen means like infarction. Now अगर आपको याद हो तो हमने एमआई में पढ़ा था माइक्रो इन्फाक्शन मतलब क्या था, वो हार्ट के मसल में जब आपको नेक्रोस हो जाता है उसको बोलते हैं इन्फाक्शन. नाउ यहाँ पर क्या है, ब्रेन सेल के अंदर बिकॉज ऑफ ब्लड सप्लाई लेस है उसकी वजह से इन्फाक्शन हो रहा है, और ब्लड सप्लाई लेस है तो इसलिए O2 सप्लाई भी लेस होगा, उसकी वजह से क्या हो रहा है, इन्फाक्शन हो रहा है. सो ये आपका मेन है. impaired circulation then lead to CVA और life threatening condition है. Okay, CVA is not like a simple discontinuity, will be life threatening condition है. So बहुत important topic है. हम बोल सकते हैं ब्रेन अटैक, जो हमने हार्ट का पढ़ा था हार्ट अटैक, यहाँ पर आपका ही ब्रेन का अटैक है तो इसका नाम ब्रेन अटैक या स्ट्रोक भी बोलते हैं. नाउ नेक्स्ट विल बी इसके टाइप्स क्या क्या हैं. तो दे हैव मेनली टू टाइप्स, इस्चेमिक स्ट्रोक एंड हेमरेजिक स्ट्रोक. इस्चेमिक स्ट्रोक एंड हेमरेजिक स्ट्रोक. ओके, इस्चेमिक स्ट्रोक कौन सा है, मतलब नाम समझ में आ रहा है, इस्चेमिया. जो इस्चेमिया हुआ ब्लॉकेज ऑफ इंट्रावेस्कुलर एरिया ऑफ द ब्रेन. ओके, जो इस्चेमिया हुआ मतलब किससे इस्चेमिया होगा, मे बी आपका आर्थरोस्क्लेरोसिस हो, मे बी थ्रोम्बोसिस हो, एम्बोलिज्म हो, ये सब मिलके क्या कर सकते हैं, इस्चेमिया कर सकते हैं. ओके, एंड हेमरेजिक स्ट्रोक क्यों है, बिकॉज रप्चर ऑफ द ब्लड सप्लाई टू द ब्रेन. ओके, सो उसके रीजन क्या क्या, उसके कॉजेस क्या है, हाइपरटेंशन है, ओके, माइक्रोनिज्म है, और any injury to the vessel also can do that. Okay, so ये हमारा क्या हो गया, ischemic and hemorrhagic. Okay, ischemic stroke will be more common compared to hemorrhagic. अगर क्वेश्चन एग्जाम में आ जाए which stroke is common, तो याद रखना ischemic stroke will be common. हमने क्या पढ़ा, there are two type of stroke, ischemic and hemorrhagic. ischemia means because ischemia होता है ना, ischemia ने पढ़ाई है कार्डियक के अंदर आर्थरोस्क्लेरोसिस, प्लेक फॉर्मेशन, तो सेम थी कॉज यहाँ पर भी है, थ्रोम्बोसिस है, एम्बोलिज्म है. हेमरेजिक में क्या है, हाइपरटेंशन है, एंड माइक्रोनिज्म, ऑल आर द रीजन. ओके, नेक्स्ट हम बात करेंगे कि सबसे क्वेश्चन एग्जाम आ जाए कि विच इज द कॉमनेस्ट कॉज ऑफ सीवीए. कॉमनेस्ट कॉज सीवीए क्या है आपका, हाइपरटेंशन, STN. ओके, द कॉमनेस्ट कॉज ऑफ सीवीए इज हाइपरटेंशन. प्लीज याद रखना, कॉमनेस्ट क्या आपका, STN, हाइपरटेंशन इज द कॉमनेस्ट कॉज विल बी हियर. ओके, देन उसके अलावा क्या कॉज है, देयर विल बी अदर कॉज विल बी thrombosis, okay, and apart of that will be have a hemorrhage, thrombosis, and or also causes of CVA. Okay, but commonest cause क्या है आपका, hypertension, because hypertension lead to so many problems. तो यहाँ पर आपका hypertension आपको याद रखना पड़ेगा, क्वेश्चन एग्जाम में आ सकता है. Okay, now next we will think the risk factor में बात की, रिस्क फैक्टर में देखा ही हमने, लिखा हुआ यही है, हाइपरटेंशन रिस्क फैक्टर मेंशन किया हुआ है. उसके अलावा डायबिटीज, नाउ डायबिटीज पेशेंट और हाइपरटेंशन लाइक ब्रदर सिस्टर. ओके, सो हर किसी को डायबिटीज है उसका हाइपरटेंशन हो सकता है, और हाइपरटेंशन को डायबिटीज हो सकता है. सो लाइक डिस्कंटिन्यूटी का डायबिटीज में क्या होगा, डिक्रीज ब्लड सप्लाई. ओके, सो इंक्रीज ब्लड शुगर लेवल, डिक्रीज शुगर लेवल इन द सेल, सो बॉडी विल ट्राई टू डू सम एक्शन, दैट्स व्हाई देयर विल बी हैव अ चांस ऑफ CVA. आर्थरोस्क्लेरोसिस आर्टरी से पता ही हमने बात किया, ये एनी कार्डियक डिजीज लाइक MI, एंजाइना, all this also can lead to CVA. Okay, this also can lead to CVA. Now next हम बात करेंगे stages of CVA. उसमें फर्स्ट क्या है, ट्रांसिएंट इस्चेमिक अटैक, TIA. बहुत कॉमन क्वेश्चन में आता है. व्हाट इज TIA? इज अ वार्निंग साइन ऑफ इंपेडिंग CVA. ये CVA नहीं है, ये आपका वार्निंग साइन है कि आपने अगर इसको ट्रीटमेंट नहीं किया तो दिस कैन बी कन्वर्ट ऑन CVA. ओके, एंड ब्रीफ न्यूरोलॉजिकल डेफिशिएंट हो जाने वाला है लेस देन 30 सेकंड तक या समथिंग डेफिशिएंट न्यूरोलॉजी फंक्शन है पेशेंट के अफेक्ट कर जाएंगे. ओके, सो दिस वी कॉल ट्रांस इस्चेमिक अटैक. TIA इज द फर्स्ट स्टेज ऑफ CVA. ओके, so remember one thing, question आ जाए कि the first step CVA, TIA, and how much time second will be there, less than 30 seconds. Remember this thing, less than 30 seconds is the answer for that. Okay, next question, next stage, stroke in the evolution, then progressive development of a stroke symptom for hour to day. Okay, now what you done, patient have a symptom, neurologic symptom, and आपने उसका ट्रीटमेंट नहीं किया, पेशेंट सिम्टम फॉर 30 सेकंड एंड 30 सेकंड आपने ट्रीटमेंट नहीं किया तो क्या हो गया पेशेंट के अंदर? पेशेंट विल बी हैव व्हाट? पेशेंट विल डेवलप this less than 30 seconds patient will develop stroke because will be within hour to day your weight. okay, आपने 30 सेकंड वेट किया तो विद इन आवर और डेज के अंदर वो स्ट्रोक के अंदर कन्वर्ट हो सकता है, बट नॉट कंप्लीट स्ट्रोक. then after that will be a complete stroke. okay, after that will be what happen? there will be a complete stroke develop. okay, there will be a neurologic deficit remain unchanged. अभी लॉन्ग टाइम के लिए ना आपका नर्वस सिस्टम अफेक्ट कर जाएगा बिकॉज पहले क्या हुआ था? सी नाम समझ जाओ, ट्रांसिएंट इस्चेमिक अटैक. Now similar like angina pectoris. Angina pectoris में क्या था? There will be imbalance of supply and demand and lead to ischemia or to the myocardium. यहाँ पर same thing है, reduction of the cerebral blood flow, oxygen और they lead to first ischemia कर रहा है कि आप warning sign दे रहा है. So same thing हमने MI में बोला था, MI के अंदर भी angina एक warning sign देता है कि MI में कन्वर्ट हो जाएगा अगर आपने ट्रीटमेंट नहीं किया. Okay, so this is a warning sign. So उसके बाद आपने 30 सेकंड तक angina में ऐसा नहीं, angina में you can wait, but यहाँ पर CVA is a brain deficit, brain problem, so we cannot wait more time. So less than 30 second will be a neurological problem. Then आपने सब ट्रीटमेंट नहीं किया तो within an hour to day they will be have a develop symptom will be worse, progressive development of stroke symptom will be there. symptom आगे पढ़ेंगे symptom क्या क्या होते हैं. okay, then they will be lead to अगर आपने hour to day ट्रीटमेंट नहीं किया, will wait for 1 day or will be wait for 8 or 12 hours, then will be lead to complete stroke. means the unchanged जो सिम्टम है आपके वो अनचेंज होके क्या हो जाएगा? they will be lead to CVA, complete CVA. okay, ये हमारा हो गया CVA. now we'll discuss sign and symptom of the CVA. sign and symptom of CVA. now very important thing here in CVA, the patient will be start symptom headache. question आ जाए worse headache. patient say worse headache and first time headache, so will be a symptom of CVA. dizziness, confusion, disorientation, fever, bounding a pulse, then hemiparesis and hemiplegic. okay, now what is hemiplegic? Is a muscle weakness and partial weakness. okay, and hemiplegic like same like a paralysis. okay, so this all symptom will be have present in the patient. okay, but very important thing, there will be depend symptom on the how much cause will be affected. okay, and there will be a neurological abnormality will be have first, increase ICP will be there, but you will remember the LOC are affected, level of consciousness. okay, I told you patient have neuro problem, so how we'll get to know as a healthcare worker what are the neuro symptom. so will be a LOC. what LOC is a will be a first thing which will be affected to patient. so LOC will be affected. so how we'll get to know altered LOC? the confusion, okay, coma, drowsiness, disorientation is a symptom of altered LOC. okay, confusion, coma and drowsiness and disorientation a symptom of the altered LOC. apart from that there will be one symptom fast. we'll say the name short form is a fast. okay, there will be a short form is a fast, F A S T, F A S T, short form is a fast. now what is fast? There will be have facial paralysis, arm weakness, then slurred speech and time. with the time symptom will be worse. so remember fast is the symptom of the CVA. okay, so what is fast? There will be have a facial paralysis or facial drooping, then arm weakness, will be will be weakness in the arms, then slurred speech, and with the time the symptom will be the more worse. will be here. then now they will be have some like a patient of symptom both side, like left side CVA and right side CVA, like we discussed in CCF. हमने पढ़ा ना CCF में लेफ्ट साइड CCF, राइट CCF, सेम थिंग यहाँ पर भी क्या होगा? their symptom will be have left side CVA and right side CVA. now I hope you know हमारा लेफ्ट साइड का ब्रेन का फंक्शन करेगा और राइट साइड का करता है और राइट का लेफ्ट का करता है. now if patient है और राइट साइड left side brain injury, तो right side sensory are affected. okay, question exam में आ जाए, the patient have a left CVA, so what symptom affected? remember right CVA, right side symptom affected, right side sensory affected, like awareness problem, there will be problem with the language because ये हमारा क्या right side affect करने वाला है, and impaired speech, slow progress. okay, all these will be in left CVA. now इसका opposite right CVA में क्या होगा? अब right CVA है तो symptom will be in left side, So patient have left side paralysis. Okay, and यहाँ पर क्या होगा, rapid performance and short attention span. देखो हमने बात की थी पहले, we speak first thing हमने बात की लेफ्ट सीवीए, लेफ्ट सीवीए बात क्या किया है, पेशेंट को सिम्टम क्या होंगे, राइट साइड पैरालिसिस. ओके, उसके साथ में क्या होने वाला है, impaired speech and slow performance. ओके, बट राइट साइड सीवीए में क्या होने वाला है, अपोजिट लेफ्ट साइड पैरालिसिस, बट सिम्टम क्या है, रैपिड परफॉर्मेंस. आगे क्या था आपका, लेफ्ट साइड सीवीए में परफॉर्मेंस स्लो था, बट राइट साइड में आपका परफॉर्मेंस हाई हो जाएगा एंड शॉर्ट अटेंशन स्पान विल पेशेंट हैव शॉर्ट अटेंशन स्पान. सो ये क्वेश्चन याद रखना, slow performance will be left side CVA and rapid performance will be the right side CVA. This option also can ask you in exam. Now next thing will come to the diagnostic. Now how will diagnose the patient with CVA? So by history taking, and apart from that we will go for CT scan, MRI, EG and cerebral angiography. These all tests will be tell you about the brain function. Apart from that we will go for blood test, you will go for urine test. This also will be guide you here what are the problem with the patient. Okay, next thing, in management, what to manage, obviously the priority always will be airway. So patient will have a problem with this thing. So first what we'll do, we will maintain patient airway and adequate ventilation. A, B, C will be the priority. Apart from that will be monitor vital signs, monitor the vital signs of the patient, monitor the vital signs of the patient, then neurological checkup and ICP symptom also will be monitor. So monitoring all things will be done for patient. Okay, so here the first thing will be ABC. Question aa jaye ki which is priority wise question, the treatment of CVA. Okay, and आपका लिखा है maintenance will be priority. Okay, then after we monitor the vital signs, then provide nutrition to patient. Okay, and then will be give the drugs. Now drug like a anti-osmotic agent, corticosteroid drugs, anti-convulsion, thrombolytic, anticoagulant, anti-hypertensive. Because हमने बोल दिया है hypertension is the most common cause of CVA, so we have to give this drug. Apart from that, there are so many drugs also will be given depend on the condition, like thromboantiotherapy because thrombus buildup हो चुका है, because hemorrhage is there. So on that basis we can go the treatment. So question will come in exam कि what is a CVA? So remember we will reduction the cerebral blood flow. Now इन सर्जिकल ट्रीटमेंट क्या करेंगे हम, कार्डियक एंडोटोमी, जो भी कार्डियक जो भी यहाँ पर हुआ है ब्लॉकेज को निकाल देंगे, एंड वी कैन डू मैकेनिकल एम्बोलिक रिमूव कर सकते हैं, वी कैन रिमूव द मैकेनिकल एम्बोलिक रिमूव कैन आल्सो and can done, and apart from that we can do the craniotomy for this patient also is a procedure can be also done. Now is also present. Now in nursing management the acute phase of CVA will be 12 to 24 hours, 12 to 24 hours. Okay, now in this patient ask question ki patient has a CVA, so which position will give, so will give position head and elevated, head patient will be give 15 to 30 degree. So क्या होगा, increase the venous return. Okay, so we'll give position to the patient head elevated, will not give supine position to the patient. Okay, then will be apart from that we'll have to monitor the symptom like patient will be bedridden, so DVT, deep thrombosis can have a chances we discussed in yesterday lectures. Okay, so this also will be make sure कि compression मुगा पे करना पड़ेगा, and first 12 to 24 hours very important thing, you need to give NGT food only because there will be loss of gag reflexes. Okay, तो patient का swallowing और chewing नहीं हो पाएगा, so because this thing we need to this thing. So as a nursing point of question क्या रहता है, which are what are the acute phase in the CVA, so 12 to 24 hours will be acute phase, and comfort position में क्या दोगे, head elevated will give 15 to 30 degree, and you have to maintain air is very important thing. Apart from that will be monitor the complication like DVT, all this thing, and nutrition also. Starting in the first acute phase will give the food with the NGT only, will not tell the patient to eat food because there are chance of loss of gag reflexes and can be have a chance of aspiration. Okay, so they are the CVA. I hope clear CVA. So we'll go for next topic, myasthenia gravis. Muscle weakness, myasthenia gravis. Remember the myasthenia is a muscle weakness, simple empathetic. Okay, now what happened in the myasthenia gravis, we'll see the first patient have a neuromuscular disorder in which the disturbance, okay, in which there will be a disturbance in the patient where, sorry, patient have a neuromuscular problem where patient will be have a disturbance in the transmission of the impulses from the nerve to muscle cells at the neuromuscular junction, causing an extreme muscle weakness. Okay, causing a extreme muscle weakness. There are symptom in the patient. Okay, so what is the myasthenia gravis will come in mind. Remember, is a muscle weakness. Oh, a neuromuscular junction will be not getting proper impulses, not getting proper impulses, or muscle nerve will be affected. So this will be have a myasthenia gravis and patient have a muscle weakness. So you see the some small pathology here. Is a autoimmune disorder. Okay, question what is myasthenia gravis? Is a autoimmune disorder. The antibody destroy. The antibody destroy करेगा किसको? Impulse को destroy करेगा passes करने के लिए. etc. receptor will be site. So I hope you know we have dopamine receptor and all receptor. तो इसकी वजह से we are getting impulses. Okay, तो क्या करेगा? Receptor को damage कर देगा. So the post-synaptic membrane will not getting the impulses. So the neural junction also affected and voluntary muscle are affected. Remember which are affected? Voluntary muscle जो हमारा hand movement all से affect करता है. हमारा heart movement, heart is involuntary muscle, so it's not affected. Remember question ऐसे में आ जाए. Patient have a hand problem, hand muscle problem. So what are these conditions? Remember myasthenia gravis, because we are telling in myasthenia gravis patient have voluntary muscle are affected. Okay. Now what is pathology here? Their autoimmunity or own immunity try to damage with the making antibodies, and antibody destroy the acetylcholine receptor and will be present in the postsynaptic membrane, and the receptor will not get. I hope you know the picture. Okay, we have like this type of structure. Okay, and like the will be a receptor here, and we're getting all these things. Receptor dopamine will get from here, and will be get impulses. जो हमने बात की थी ना structure nervous system की neurons के बारे में, same thing will get impulses. Okay, now next will be what will we have? Next will be have risk factor. Will be have genetic factor. Okay, now we'll discuss the what are risk factor. Genetic and female will be have more myasthenia gravis. CVA will be more in the male and myasthenia gravis more in the female. Okay, and type 2 hypersensitivity reaction are also can lead to that. Type 2 hypersensitivity reaction also can lead to the myasthenia gravis. Okay, then what next will be have? Now we'll come to the sign and symptom. Sign and symptom we'll discuss now. Now patient have a obviously symptom will be a first thing, the voluntary muscle. The voluntary muscle are weak. Okay, voluntary muscle are weak is the first thing symptom remember. Okay, voluntary muscle will be a fatigue or lethargy, all symptom we have. Apart from the diplopia, double vision. Patient have a double vision. Okay, diplopia, dysphagia, difficulty to swallow, ptosis, one eye is not opening, weakness in face, hoarseness of voice. Okay, all other symptom will be here. Then will be apart from the symptom have, they will be have problem with the symptom like is not able to open proper mouth, voice are affected, all things will be done. Okay, now is a symptom. Now as a medical, how will prove patient have myasthenia gravis? So for this very important thing, we have a very important test for that. It's called tensilon. Okay, tensilon. Now diagnostic में जाएंगे हम. Okay, now how will diagnose? History and physical examination. History and physical examination. उसके अलावा we'll go for EMG, ABG, and confirmation test will be tensilon test. So क्या करेंगे हम? Patient को IV. Patient को हम क्या करेंगे? IV injection tensilon will provide. IV injection will be given to the patient, and then if patient symptom is relieved spontaneously, the symptom is relieved means significant the tension is affected, मतलब patient को myasthenia gravis है. याद रखना, will be confused here. Question क्या आएगा कि tensilon test positive. After giving tensilon, the symptom is relieved. So what is meaning of that? That meaning of the patient relieve the symptom means there will be a myasthenia gravis. Okay, relief symptom will be there. Apart from that, we'll go for EMG and serum antibodies, which I make highlighted. Okay, why? Because it's also important thing. EMG and serum antibodies will be also used to diagnose the myasthenia gravis. Okay, next will be apart from that, we'll go for X-ray and will be used for that. Now we'll come to the treatment. in treatment will give the anticholinergic drug will be given to patient which block the action of cholinesterase and increase the level of acetylcholine. हमने क्या बोला, आपका एसिटाइलकोलिन जो रिसेप्टर है वो ब्लॉक हो गया है, तो हमको ड्रग देनी पड़ेगी जो एसिटाइलकोलिन को बढ़ा दे, तो इंपल्स इजीली कैन पास करेंगे, तो विल गिव दिस ड्रग. ओके, अपार्ट फ्रॉम दैट we'll go for thymectomy. Now is not proper proof, but thymus also is a important factor. Thymus are involved in the production of the acetylcholine receptor inhibitory antibodies. Thymus क्या करता है, acetylcholine antibodies बनाता है, जो मैंने पढ़ा ना, antibodies बना रहा है पर, तो thymus को रिमूव कर देंगे तो एंटीबॉडी नहीं बनेगा, तो क्या होगा, they have a less chance of causing myasthenia gravis. Okay, they have a less chance of myasthenia gravis. So that's why thymectomy required. Remove the thymus gland. Then plasmapheresis. Okay, means changing of whole plasma. Remove the circulatory acetylcholine. So receptor antibody. So क्या करेंगे, क्या चाहते हैं, हमने क्या पढ़ा डिस्क्रिमिनेशन के अंदर, ये पेशेंट के अंदर एंटीबॉडी आ गया एसिटाइलकोलिन रिसेप्टर को मारने वाला, तो हमने क्या किया, नेक्स्ट टाइम से एंटीबॉडी बनेगा ही नहीं क्योंकि थाइमस ग्लैंड निकाल दिया है. ओके, देन अभी जो एंटीबॉडी प्रेजेंट है उसके क्या करेंगे, हम प्लाज्मा फ्रेश कर देंगे, प्लाज्मा चेंज कर देंगे, तो जो एंटीबॉडी प्रेजेंट है वो भी निकल जाएगा. सो देयर विल बी सिम्पटम बी रिलीज एंड विल व्हाट डूइंग, हम एसिटाइलकोलिन के लेवल को बढ़ा रहे हैं, जब तक बढ़ा रहे हैं तो क्या होगा, नेक्स्ट टाइम द इंपल्स विल बी पास वेरी फास्टली. ओके, so these are the important treatment we can do in this patient. Okay, now apart from that इसमें एक आता है myasthenia crisis. Okay, the complication of myasthenia gravis is a myasthenia crisis. The worst from myasthenia gravis, symptom जितने worst होंगे उसको बोलेंगे myasthenia gravis. symptom जो आपको दिख रहे हैं, diplopia, all these things, symptom will be more worse and patient will be a sedative effect more. So okay, यहाँ पर patient का air भी affect कर जाएगा and this also will be a problem. उसके अलावा आता है cholinergic crisis. Okay, is also a condition जहाँ पर भी symptom will be more worse and overdose of acetylcholine. Okay, जब आपने ड्रग ज्यादा दिया, your drug give more drug, okay, dose, so this also increase the impulse power, so this also can lead to cholinergic crisis. Okay, so there are the some complication with the patient. Okay, and tensilon test कैसे करते हैं, they will be will give IV drug to the patient and will see the symptom will be relieved. So it's about the myasthenia gravis. So what to remember myasthenia gravis, they will be affect the what, neuromuscular junction. The first रखना, second thing in कि अब autoimmune will be a problem, then antibody produced against the acetylcholine. Okay, and will be affect their voluntary muscles. They are the main thing, remember. Apart from symptom will be a voluntary muscle, diplopia, dysphagia, other diplopia, double vision, dysphagia, difficult swallowing, ptosis will be one eye is not proper opening, weak face or face weakness or hoarseness of voice. And tensilon test is a confirmation test for myasthenia gravis. Remember, tensilon tests are a confirmation test for that. Okay, and EMG and serum also use test for confirm with the for diagnostic the myasthenia gravis. And these are the treatment we can do in the patient. Okay, so it's about the myasthenia gravis. I hope you understood myasthenia gravis. So we'll go to the next topic now. Next topic is a Glasgow Coma scale. बहुत सिंपल स्केल है. There's so many time I ask question exam. GCS शॉर्ट फॉर्म क्या है इसका, ग्लास्को कोमा स्केल. अदर नाम क्या है इसका, न्यूरोलॉजिकल स्केल भी बोलते हैं. ओके, यूनिवर्सिटी ग्लास्को बना था इसलिए इसका नाम ग्लास्को कोमा स्केल रखा है. यूनिवर्सिटी ग्लास्को में बनाया गया था इसलिए यूज किया था. एंड इसका क्या काम है, ग्लास्को कोमा स्केल will be used the most common scoring system to describe the level of consciousness. Now we want in immediate phase, हमको इमीडिएटली जानना है कि पेशेंट का लेवल ऑफ एलओसी कितना है, लेवल ऑफ कॉन्शियस कितना है, विद द वे पर्सन हैव एनी ब्रेन इंजरी और एनीथिंग विल बी हैव, हमको उसका स्कोर जानना है. सो विल बी यूज दिस थिंग. 1974 बना था. मैक्सिमम स्कोर 50 में है, मिनिमम 3. याद रखना इसका मिनिमम स्कोर 0 नहीं है. इसका मैक्सिमम स्कोर 15 एंड मिनिमम स्कोर कितना है, 3 विल बी स्कोर ऑफ द मिनिमम विल बी हैव इन द पेशेंट. ओके, एक क्वेश्चन आता है आपको याद रखना. नाउ विल सी द स्केल. ग्लास्को कोमा स्केल भी हैव 3 थिंग्स, 3 पैरामीटर: verbal response, eye response, verbal response and motor response. By picture you can easily understandable. Now in eye response, spontaneous opening eye, not saying anything और eye open कर रहे, जो हम open कर रहे हैं उसको बोलेंगे spontaneously. Next thing, टू साउंड, जब साउंड प्रोड्यूस होता है, कुछ आप पूछते हो पेशेंट को कि telling the name, asking name and opening eyes, so will be sound. To pressure or to pain, while giving pressure or pain to the that time patient responding eye, मतलब पेशेंट को ईयर पिन्ना में या कि पेन दे रहे हो तब उसका आई ओपन कर रहा है और आई रिस्पॉन्ड नहीं करता तो हम 0 नहीं 1 स्कोर करते हैं, बिकॉज ग्लासगो स्कूल में 0 का नाम ही नहीं है, याद रखना, will be not have a 0 score. Okay, then next come to the verbal response. Now when see the person is oriented, so will be have 5 marks. Okay, 5 marks will be give. Then when ask patient ki who are you, so he confused, not able to tell his proper name, पूरा नाम बता नहीं पा रहा है, तो 4. Then you will be have inappropriate word, उसका word मतलब घर, home, like will be something making a two word together, और proper इसके word नहीं है तो 3. Inappropriate sound, like sound will be have not able to proper sound, so will be 2. No responding 1. Okay, patient will be not able to speak, बोल नहीं पा रहा है, क्वेश्चन आता है कि patient is not express the feeling, so what score will be give? Remember will be 2 score because it's a inappropriate sound. क्वेश्चन आता है express the feeling is not there in the GCS by the patient, so what score will be give? Remember 2. Okay, because inappropriate sound. Next will become no response, patient not having any response, so will be given 1 not 0. Okay, now come to the motor, ये 6 skill होती है इसके अंदर. Now when tell patient move the hand or leg, so obeying command, moving these things, so will give 6 point. When you will be giving like painful stimuli, means like localizing painful or pressure given to patient, that time patient never movement, so will be a 5. Next thing, there will be normal flexion, will tell will giving pain, so patient will be normal flexion. आप patient को पेन दो तो हाथ अपने को खींचता है, तो 4. और आप पेन दे दो पेशेंट अब नॉर्मल कर रहा है, उसको क्या बोलेंगे हम? डिकोर्टिकेट. ओके, इसको बोलेंगे हम डिकोर्टिकेट इज देयर. ओके, सो विल बी 3. एंड देन एक्सट्रैक्शन करता है अब नॉर्मल, तो सो उसको बोलेंगे डिसेरिबेट, विल बी 2. सो ये क्वेश्चन से में आता है व्हाट इज डिकोर्टिकेट एंड व्हाट इज डिसेरिबेट. सी हमने बात की फर्स्ट में ओबेस कमांड, जहां आप जो भी बोल रहे हो फॉलो कर रहा है, तो इसको भी हैविंग ओबेस कमांड. देन व्हाइल गिविंग पेन, जब पेशेंट को पेन होता है तब पेशेंट मूवमेंट करता है. ओके, नेक्स्ट थिंग, पेन जब पेन देता मूवमेंट करता है. नेक्स्ट विल बी व्हेन आप गिविंग पेन दैट टाइम नॉर्मल फ्लेक्शन, पेशेंट अपना हाथ को खींचता है. ओके, सो दैट टाइम विल बी 4. देन विल बी हैव डिकोर्टिकेट, मतलब अब नॉर्मल फ्लेक्शन, मतलब पेशेंट का मूवमेंट कर रहे हो तो उसका हाथ के मूवमेंट थोड़ा अब नॉर्मल रहता है, विल बी हैव फ्लेक्शन है बट अब नॉर्मल है. और 2 मतलब क्या? डिसेरिबेट, पेशेंट को पता ही नहीं पेन कहां से हो रहा है, तो अपना हाथ को वापस एक्सटेंड कर रहा है. आप पेन दे रहे हो, हाथ को आपको दे रहा है कि वो पेन करो, सो विल बी लाइक विल बी सो डिकोर्टिकेट एंड डिसेरिबेट. Now which is a mild Glasgow scale 13 to 15, moderate will be 9 to 12, and severe less than 8 are the severe. There will be never 0. Remember क्वेश्चन आता है मैक्सिमम स्कोर 15 आ जाता है, बट हम भूल जाते हैं कि ग्लासगो स्केल का मिनिमम स्कोर 3 ही है. will be 3 will be the answer. क्वेश्चन आ जाए, a patient come in emergency department with a head injury patient, eye opening with a pain to stimuli, verbal response inappropriate, and motor is not a response, so क्या स्कोर दोगे? क्वेश्चन आ सकता है. एनीथिंग लास्ट क्वेश्चन. नाउ रिपीट क्वेश्चन. क्वेश्चन है one patient admitted in emergency department with a head injury, patient have eye opening with a painful stimuli, मतलब 2 pressure मतलब 2. okay, verbal response with an inappropriate word, मतलब क्या हो गया हमारा 3, so 2 plus 3 5. then the motor activity as decorticate, मतलब क्या हो गया हमारा डिकोर्टिकेट, मतलब will be have 3, so 3 3 6 और 2 कितना हो गया 8, तो जीसीएस कितना हो गया 8, like will be have asked in exam in question. okay, next thing will go to the next discrimination. I hope clear GCS, सिंपल टॉपिक है बट एक दो क्वेश्चन इसमें एग्जाम में आते ही हैं जीसीएस के. ओके, याद रखना जीसीएस will be important for assessing the level of consciousness. okay, next topic will go for Parkinson disease. Parkinson disease, it is a neurological disorder which caused by decreased dopamine. इसमें याद रखना क्या प्रॉब्लम है? डोपामिन का प्रॉब्लम होता है. There will be a problem with dopamine. Okay, now we'll see definition. Is a degeneration of the nerve cell in the basal ganglion resulting generalized and decline muscle function. यहाँ पे आपके मसल फंक्शन अफेक्टेड, बट डोंट बी कंफ्यूज. हाँ, मसल का वीकनेस था, यहाँ मसल फंक्शन abnormality है. ओके, so don't be confused here. Like will be patient have like सिम्टम लाइक रिजिडिटी होगा, विल बी स्लोनेस मूवमेंट लाइक ब्रेडिकाइनेशिया और सिम्टम रहेंगे, बट आपका फंक्शन अबनॉर्मलिटी हुए वो आपका मायस्थीनिया ग्रेविस है. Okay, now what is the pathology here? You can see degeneration of the dopamine that lead to produce the neurons in the substantia nigra and midbrain. They lead to depletion of dopamine. They lead to degeneration of the basal ganglion and generalized decline in the muscle function. Simple thing, जब डोपामिन कम हो जाएगा तो डोपामिन आपका कहाँ अफेक्ट करने वाला जाके ये आपका ब्रेन का पार्ट है मिड ब्रेन एंड सबस्टेंस नाइग्रा. Okay, nigra, I hope you remember nigra. Okay, is a point will be here, substance nigra will be there, question आता है. Okay, and then lead to more dopamine problem, more depletion, and then lead to affect your basal ganglion. और याद रखना कहाँ पर basal ganglion affected, and then will be lead to motor function. So आपको याद करना Parkinson में they will be affected because of decreased dopamine. Okay, there will be result in the dysfunction of dopamine. There will be problem to the patient. Okay, then lead to affect your basal ganglion, affect to the basal ganglion, and basal ganglion lead to a generalized muscle function, generalized decline in the muscle function. Now we'll discuss the causes. The maximum causes will be unknown. We don't know what is the cause, but post encephalitis, toxicity, arteriosclerosis, traumatic injury और drug overdose, ये कुछ causes हैं जो कर सकता है. और sometimes pollution also can lead to the Parkinson's disease, can affect to the patient. Okay, and in medication, if patient have a long time antipsychotic drug, okay, this also can lead to Parkinson's disease. Okay, now next we'll come to the silent symptom. Now याद रखना एक silent symptom में इसका एक sign बोलते हैं cardial sign. Okay, will be called cardial sign. Now will be a cardial sign. क्या होता है? The tremor will be present, rigidity and bradykinesia. TRB, not TRB, the symptom. TR and B means tremor, rigidity and bradykinesia. Okay, these are three symptoms are present together. So this is called cardinal sign. Okay, it's called cardinal sign. Okay, so हमने देखा ये rigidity में यहाँ पर लिखा ये rigidity, slowness of movement is bradykinesia, and tremor also together is called cardinal sign. Okay, and patient will be have a stop posture. Posture movement इसका कुछ भी नहीं होगा, not any movement. Shuffling will be there. Get से movement कोई भी नहीं है. Eye decrease blinking, eye movement नहीं हो पा रहा है. Increase salivation and drooling. Mask like face. Patient का face एक जैसा ही होता है. Not having any movement of eye, nothing movement will be here. Okay, then will be a robotic like structure, like will be called a shuffling gesture. मतलब patient is not able to any movement, robot जैसा एक जगह खड़ा रहेगा. Okay, impaired body movement. So याद रखना cardiac sign. Cardiac sign क्या है? Tremor, rigidity and bradykinesia. याद रखना tremor, rigidity, bradykinesia. TRB. हम TPR BP पढ़ते हैं, याद रखना TRB. Okay. Now next thing we'll think about what is are the treatment. Treatment में क्या है? Will give the levodopa. Okay, levodopa will give levodopa drug to give to patient to increase dopamine. Okay, will give levodopa. I mentioned dopa because remember कि levodopa is drug. Levodopa is drug will be given to the patient which will be directly increase your level of the dopamine. Okay, so I mentioned internship dopa levodopa. So remember the drug will be levodopa is drug. Levodopa drug will be used for the dopamine. So remember आधा अक्षर में levodopa drug will be used in which condition? The Parkinson's disease. क्यों यूज करते हैं? Because increase vitamin, so increase the dopamine. Now next, avoid multiple preparation drugs. हम multiple vitamin नहीं देंगे, only will give. Okay, we are avoiding giving the drug will be for some time. Vitamin B6 will be avoided because of this can lead to anti-Parkinson effect. So we'll never give vitamin B6 drug. Okay, is a 6 will be there, so we'll not give this thing. Okay, so we'll give the food, but drug we will not give. Okay, then apart from that, anti-cholinergic drug also can give to patient with a combination, so controlling the tremor and all this thing. Okay, controlling and all this thing will be. That's why remember क्या पढ़ा हमने इसके अंदर में इसके टॉपिक के अंदर क्या पढ़ा हमने? There will be Parkinson disease will be affect in the basal ganglion. Problem with the dopamine lead to muscular function and affect the sustained and nigra midbrain. Okay, these are the something we already this thing, and we discuss the maximum unknown causes, and we have cardinal sign TRB, tremor, rigidity, and bradykinesia. Then we discuss levodopa drug will be used for dopamine increase. So I mentioned dopa, levodopa. So remember dopa, levodopa is the trick. I remember. Okay. So dopa and levo. So battery understand कि dopamine के लिए काम आता है. Then we'll give avoid multivitamins, especially vitamin B6 will be avoid because we blockage the anti-Parkinson medicine. So आपका medicine जो काम है उसको अफेक्ट करता है. So we'll not give this drug. Okay. Apart from that, we'll give the drug anticholinergic with the combination drugs, so we can be control the tremor and rigidity. Now, question exam में आता है, the nursing point of view, what is the first priority? So first priority will become safety of the patient. Okay, and the question will become exam में क्या आएगा? Safety will first. Now diet. What diet will point the patient? Will be have a high calorie, high fiber diet will be given to the patient because this will be due to loss of energy. Patient will not have energy, so will require high calorie diet. So this will be require high calorie and high fiber diet given to the patient. Okay. This is about the Parkinson disease. I hope clear Parkinson disease. Next, we'll go for Bell's palsy. Bell's palsy. Now, इसका अदर नाम क्या है? Facial palsy. और facial palsy का मतलब weakness of the face, weakness of the face or paralysis of the face. So, disorder of the seventh cranial nerve. Okay, याद रखना. Disorder of the seventh cranial nerve lead to Bell's palsy. Okay. Now the result will be loss of the movement of the muscle in the one side of the face. Okay, loss of the one side in the face. So we should be not able to move the properly face. Next thing, their causes may be viral or autoimmunity. Autoimmune will be have this thing. Okay. Then CVA, head injury, brain tumor, and encephalitis also cause of facial paralysis. But the maximum cause also same thing here also is maximum is unknown. Okay. From facial paralysis will be a lower neuron affected. That's why will be affecting weakness of the face and will be a self resolving within a 6 month. पेशेंट का जो फेशियल पैरालिसिस है 6 month के अंदर will be try to recover by own. Okay, so will be important thing will be not recover very early, will take time at least 6 months. Okay, now come to the clinical sign. There will be loss of taste over the anterior 2/3 tongue because they have facial paralysis. So they will what happen? There will be loss of taste in the one anterior 2/3 the tongues. Then complete paralysis in the face. One side of face is a complete paralysis, no movement of eye. So what happens? There will be a chance of in eye infection. Apart from that, what will be have? There will be loss of expression, displace pain of mouth toward the unaffected side and inability to close eyelids. So patient अपना eye properly बंद नहीं कर पाएगा. जहाँ भी उसका affected हुआ है, there will be a one side of face is affected. Then there will be what problem will be a patient will be a wrinkle in the face, wrinkle in the one side. Okay, the affected side में क्या होगा? Wrinkle face you can see. Now imagine the one face is look like wrinkle, so it is a diagnosis of paralysis. Okay. Apart from that, now how will diagnose the this condition? By history taking, by CT scan and MRI is the main thing will be tell you patient have a Bell's palsy. Now management will be give drug like corticosteroid because हमने बात की थी कि इसे autoimmune disorder. So हम क्या करेंगे? ऐसा ड्रग देंगे जो खुद की मिट्टी को प्रॉब्लम नहीं करे. So we'll give this drug. इस ड्रग का नाम क्या है? Methyl prednisolone drug will be used. This lead to decrease inflammation of myelin sheath and conduction can be improved. Now I hope what is myelin sheath? जो हमारे नर्व को कवर करता है वो myelin sheath होता है. Okay, तो हम क्या ड्रग देंगे? Methyl prednisolone drug will be the commonly used for this patient because we want to improve the conduction system. Okay. Next thing, we will be give to the patient soft diet and instruct the chew take proper diet chewing of the food because affected side में वो क्या properly चबा नहीं पाएगा. So we advise the patient, we nursing point question आ सकता है. Okay, then avoid hot and fluid, hot food or fluid will be avoided to patient, because this can lead to more problem, because we don't require giving hot, because hot can be decrease your conduction system, okay, or this lead to more inflammation. That's why we not give. And tell patient wear the dark glasses, because we want the eyes open, because I told you it's one side affected. So क्या होगा patient का eye open ही रहेगा. So what happen that time? There will be a chance of infection. That's why we require tear. Tear will be for prevention of infection. So that's why I will give artificial tear to prevent dryness of the cornea and eye patches. Okay, a maximum time night, because night time uska kya hoga, will be a opening of eye and difficulty to that time. So that's why we need to will give artificial tear, and for that we are giving some antibiotic also we require to give, because can lead to this infection. So cephaloxacin eye drop also can be provided to the patient. Okay, and we'll give the proper nutrition support to patient. Vitamin A to Z will provide to patient, so properly nutrition also will be suitable. So हमने क्या पढ़ा Bell's palsy के अंदर से Bell's palsy facial paralysis क्या है, is affected to the paralysis to the face. Okay, paralysis to the face, and 7 canal nerves affected. Okay, and 6 months required to recover. 7 6 याद रखना. Okay, then will be affected face of one side affected. Viral, autoimmunity, head injury, CV, all can lead to this thing. And patient have a one side face affected, and loss of all movements, and pain in the eye affected, and we require some drug. Important nursing point of view, artificial tear we need to provide. Avoid hot fluid, and the foods will be there, and provide soft diet, and advise patient take proper food with the unaffected side. Okay. Next topic will go for GBS, Guillain-Barre syndrome. Guillain-Barre syndrome. The scientist name Guillain, so we is given on the his name Guillain-Barre syndrome. Okay. When Guillain-Barre syndrome will come in mind, remember do one thing: polyneuritis with autoimmune. ये भी autoimmune disorder है और polyneuritis करता है, जो मैंने headline किया. Okay, आपके neurons जो nerves हैं उसको प्रॉब्लम करता है. Okay, it will be a polyneuritis. Okay, is disorder affect to their demyelination. जो हमने बात की थी myelin sheath. I hope you remember the myelin sheath. You see, we spoke to the myelin sheath. I will once again show the picture of myelin sheath, so we will be clear this step. This is the myelin sheath जो ब्लीक और क्या कर रहा है ना, इसमें क्या होता है GBS में आपका myelin sheath भी have injury, myelin sheath भी have damage, it's called demyelination. Okay, so this is a demyelination that lead to GBS, Guillain-Barre syndrome. Okay, very important thing in this condition, इस डिसऑर्डर की खासियत है सब में सिम्टम ऊपर से नीचे आते हैं, सिम्टम डिसेंडिंग है. Okay, so we'll see definition first. This is a disorder of characterized by symmetrical bilateral peripheral neuropathy carried by ascending paralysis. Okay, यहाँ सिम्टम डाउन टू अप जाएंगे. पहले अफेक्ट होगा लेग, फिर आपका होगा अफेक्ट किडनी, देन स्टमक, देन ऑल दिस अफेक्टेड लाइक विल बी हैव सिम्टम. Okay, and we can call 21 days this syndrome. 21 days minimum will be this will be there. Okay, हम बात की थी जैसे वहां पर 6 month, यहाँ पर 21 days तो मिनिमम रहेगा, और ज्यादा डिपेंड करता है पेशेंट की इम्यूनिटी पे. Okay, so most of time the cause is a unknown, autoimmune will be here. Then viral infection and immunization also can lead to that disease condition. Streptococcal pneumonia also can lead to this disease condition. Okay, now what symptom will be have like clamminess, mild sensory changes. Okay, mild sensory changes means the symptom like patient will be have sensory will be affected. Okay, what is clamminess? Poor coordination movement. Now patient not able to have proper movement in the hand, leg not there. Progressive ascending muscle weakness, very important thing. Progressive ascending muscle weakness will be the patient symptom. One limb is affected, canal nerve involvement will be there. Dysphagia, respiratory paralysis, absence of the deep tendon reflexes, and autonomic dysfunction. See, it's difficult to remember, but remember one thing: ascending paralysis. Okay, ascending paralysis, very important thing. Symmetrical, bilateral, peripheral पोलिनर्टिस विद असेंडिंग पेयर, ये बहुत इंपॉर्टेंट पार्ट है, आपको याद रखना पड़ेगा. ओके, तो व्हाट इज जीबीएस? द डीमाइलिनेशन and patient have a ascending paralysis will be have in the patient. Okay, patient have paresthesia, numbness, all things symptom will be have. Then first symptom क्या होने वाला पेशेंट के अंदर? paresthesia, numbness and tingling feeling in the leg. Okay, कुछ एग्जाम में आ जाए the first symptom of the GBS, so affect the leg, numbness of the leg, tingling sensation in the leg or paresthesia, that's first symptom of GBS. Now come to the diagnostic. Now how will diagnose? By CSF. Okay, if you're going for CSF, in CSF there will be increased protein. अगर CSF पर check करोगे तो protein level बढ़ जाएगा, तो significant something problem with the myelin sheath. Then will we go for NCT, nerve conduction test. So ये क्या करेंगे? I will give you some conduction. I will give current to patient and patient not feel conduction means there will be some problem with the supply of the nerve. Okay, normally क्या बोलते हैं हम? कंडक्शन नहीं है तो अच्छी बात है ना, बट यहाँ पर उल्टा है. सेम थिंग टेंसिलोन में देंगे तो सिम्टम रिलीव होते हैं. यहाँ पर सेम, जब नर्व कंडक्शन टेस्ट करोगे और पेशेंट को कंडक्शन फील नहीं होता है, करंट नहीं लगता है, तो मतलब क्या है? इंपल्स पास नहीं हो रहे, तो उसका मतलब क्या है? GBS. Okay, is about this. And now come to the treatment point of view. We'll go for mechanical ventilation. Now symptom, according to symptom treatment रहेगा, because of paralysis हो रहा है आपका lower part से, so lower से upper तक जाएगा, there will be a paralysis. Then apart from that, we'll go for plasmapheresis. We'll go for plasmapheresis will be here. Then next will be plasmapheresis में बात किया ही था, he will be reduce antibody circulation, so will be change whole plasma. Then will give atropine in bradycardia patient and propranolol for tachycardia patient also will give, and symptomatic treatment also will provide corticosteroid methylprednisolone की बात की थी हमने, यहाँ भी देंगे पेशेंट के अंदर. Okay, and will be immunosuppressive will be stop drug will be give, changing whole plasma. Okay, vitamin A to Z will give to patient. This will be the treatment of this thing. And important thing here, nursing point of view, remember AABC is a priority to assess the patient, and we provide high fiber diet to provide to the patient. Okay, it's about the GBS. क्या रखना इसके अंदर? You to remember one thing, there will be a polyneurosis and ascending weakness. याद रखना, polyneurosis and ascending weakness, and third is a plasmapheresis. Question आता है. These are the three things you remember in the this slide. Next thing, come to the spinal cord injury. Spinal cord injury. Injury to the spinal cord can occur due to the motor vehicle accident, diving in shallow water, falls, industrial accident, sports, or means any injury. Okay, damage to the spinal cord caused by temporary or permanent, that lead called as spinal injury. Okay, now this is result to the so many things. Okay, now कोई हमने देख ही लिया, physical और non traumatic their reason will be here. Okay, now spinal shock की बात करते हैं. Absence of reflexes below the level of lesions is called spinal shock. There will be a facial paralysis. Okay, lack of temperature control, hypotension with the bradycardia, retention of urine and feces. Okay, इसका symptom of spinal shock. क्वेश्चन आ सकता है spinal shock क्या होता है? So the below level of injury, no movement, no reflexes, facial paralysis. Okay, then will be remember lack of temperature control, hypotension with bradycardia, and retention of urine feces. Now I hope you should know what is spinal cord. Now how much now will we have? Okay, we have 7 spinal vertebra and 8 nerve. Okay, 7 vertebra and 8 nerve, 12 pair of thoracic, 5 pair of the lumbar, 5 pair of the sacrum, and 1 will be the coccyx. Will be remember. Okay, now क्वेश्चन एग्जाम में आता है, पेशेंट was injury to the C1 to T1. So what is meaning of that? So will be a neck problem. Okay, so remember cervical injury C1 to C6. Okay, so C3 C4 5. So affect diaphragm. Okay, क्वेश्चन आ जाए कि पेशेंट was C3 C4 C5 injury. So what will be a symptom? So the diaphragm affected, so respiratory will be affected. Okay, then question comes C5 to C6 affected. So remember, shoulder movement. There will be a problem with the shoulder movement. Then come to the C6 to C7, elbow or wrist movement. C7 to T1, hand movement. So जो सर्वाइकल के जो ऊपर पार्ट है वो सब आपके हैंड तक ही होते हैं. देन T1 to T6 क्या है आपका, ट्रंक अफेक्टेड हो जाएगा. T7 to L1, abdomen muscles. L4 to L5, thigh affected, and that and sacrum will be affect the flexion of the hip. So I know it will be difficult to understand, but याद रखना क्या है, important कुछ आता है diaphragm वाला. So C3 C4 will be important for diaphragm. Okay, and remember the C1 to T1 is a neck function. Okay, neck function. Now symptom quadriplegia, respiratory paralysis, paraplegia, loss of voluntary activities, movement and sensory below the level of injury affected. So the symptom. Okay, so symptom depend on the injury level. We cannot justify symptom what happened, but there will be symptom be the below the level of injury is very important thing in the patient. Okay, now how will diagnose? How will diagnose? Go for X-ray, MRI, CT scan, neurological checkup, and lumbar puncture if infection is present. Okay, very important treatment, immobilization, because already patient has spinal injury, so we want कि there will be minimum movement, this will be no movement. We have immobilization to the patient to prevent further injury. See the ABC, airway breathing is affected. Okay, and we will be use hello traction. आता है क्वेश्चन में, स्पाइनल इंजरी कौन सा ट्रैक्शन यूज करते हैं, hello traction. So what happen, there will be no movement of the cervical. Okay, so we use hello traction to the patient, and you provide high calorie and high protein diet to the patient. We give to the drug diet to the patient. Okay, this is about the spinal cord injury. So we'll go for next topic is a meningitis. Meningitis. It is a inflammation. So inflammation of meninges. Now what is meninges? Cover of the brain and spinal cord will be meninges. So inflammation of meninges will be have meningitis. Okay. Now there will be have causes: bacteria, virus, microorganism, and CNS infection. CNS infection is the cause will be have chances in the patient. So what we can do here? What we can do here, the patient, the meningococcal infection, pneumococcal infection, as influenza, streptococcus are the commonest cause of causing meningitis. The first layer will be have pyometer, and second will be have this thing. Okay, aerometer. So immediately meningitis. So remember, there will be a commonest cause will क्या, bacteria आपका virus है, वही आपके causes हो सकते हैं. Now the classification can be, one minute. The classification will be depend on the injury. Bacterial meningitis, so will be have a influenza of bacteria, pneumonia, affected the streptococcal pneumonia. Okay, according to causality will go, according to the will go like a cause wise. So commonest infection in bacteria are streptococcal pneumonia. Okay, according to the bacteria wise, so commonest will be have a streptococcal pneumonia. But according to the age wise will go, so in children will be have a influenza will be the commonest. Okay, influenza will be common. Okay, then this is the will be there. Apart from that, the most common will be the streptococcal pneumonia, and influenza will be common in the children. Now next we will see the viral infection. Now viral infection will be have causing herpes simplex 1, herpes simplex 2. Herpes simplex 1 will be caused to the adult. Herpes simplex 2 will be caused to the child. Remember, HSV 1 will be in the adult, HSV 2 will be the child. Apart from that, Japanese encephalitis also can lead to the meningitis. Fungal infection also can lead to this thing. Okay, there are some infection what I'm telling you. Okay, now we'll go for sign and symptom. First sign of meningitis. In exam, they ask you what is the first signs of meningitis. Remember, change in LOC is the first signs of meningitis. Okay. Now, first is a sign we discuss here. Kerning sign. What is kerning sign? Contraction or pain in the hamstring muscles while attempting to extend the leg while when hip is flat. So when we're doing hip movement, patient feel the pain. Okay, flexing of hip movement that I'm doing, that time patient will be have pain. It's called Kernig sign. Next, will we have a what? Optivo optisotonus will be have a hair and heels will be backward. That time patient have a pain. Next will be have a Buddhist sign. There will be a flexion at the hip and knee. That time patient will be feel pain. So what will be symptom? Will be Kernig sign, optitonus, and Buddhist sign. Other sign will be present in the meningitis. Apart from the symptom having headache, okay, seizure, will be have a affected like a photophobia, ICP, nausea, vomiting, and nickel rigidity. Okay, what nickel rigidity? Stiffness of neck will be here. Okay, stiffness of the neck also present in the patient. Now, how to diagnose? We'll go for history and physical examinations. We'll go for lumbar puncture. In lumbar puncture, there will be, you can see the test in this confirmation test. कौन सा है? Confirmation test for meningitis is a lumbar puncture. In lumbar puncture, you will see the WBC and glucose. So there will be increase the WBC and increase glucose will get lumbar puncture. Okay. And go for CSF examination. There will get increased protein, decreased glucose, and increased WBC report will be here. So the exam will ask question the confirmation test for meningitis. So what is there? Lumbar puncture, because infection will be there, so we can present in the lumbar puncture, we can easily get out. Okay, we can get it. Okay, then come to the treatment. Treatment will give the symptomatic treatment provide to patient and affected thing like every bacteria. So antibiotic, virus, antiviral, all thing will give. Apart from that, we maintain fluid and electrolyte imbalance will be maintained to the patient. Okay, and for antibiotic, will give tazobactam. For antiviral, drug acyclovir will be given to the patient. Okay, and for fungal, will give drug apotherium. This also will be used in Kala Azar drug also. Okay, and will monitor the vital signs and neuroscience neuro checkup to the patient. Okay, so exam question क्या सकता है? Meningitis याद रखना. First thing क्या है? Inflammation meninges. Okay, then commonest will be all we discussed. The commonest cause in the bacteria. Commonest cause in the bacteria will be streptococcal pneumonia. Will the commonest will be have in the patient will be have commonest cause in the bacteria, and in most common cause in children will be Haemophilus influenza. Okay, so pediatric part also will be covering here. They are very common in the in viral herpes simplex 1 will be adult, herpes simplex 2 will be in the child. Okay, so about the in the meningitis and the Kernig sign, optisomas and Buddhist sign, all signs will be present, and the first signs of the meningitis will be level of conscious will be changed, LOC will be affected to the patient. Okay, next we'll go for encephalitis. Encephalitis. Now, simple topic. Encephalitis means a inflammation of encephalitis, inflammation of the brain caused by a virus is a herpes simplex virus, or maybe arbovirus is the common will be here. Okay, this will be an important thing. Remember here in the patient have inflammation the brain or the brain affected will be have. Okay, this lead to increased ICP. Okay, now the may occur same symptom in the measles, mumps, and chickenpox. So we'll confuse. Now what are the causes? Or we'll discuss herpes simplex is a common will be have. So most common is affected virus with herpes simplex, arbovirus. Okay, apart from that, varicella zoster, mumps, all this also can lead. Bacteria, fungus also can lead, and the respector are age, all things also the have a respector. Now next will come to sign symptom. Sign symptom will be have headache, vomiting is the symptom in the patient. Apart from the level of portions affected, drowsiness, confusion, or symptom will be present in the patient. How to diagnose? By history taking, physical examination, MRI, and important thing, antigen antibody react test done the patient. Treatment same like a meningitis. We'll go for symptomatic treatment, monitor vital signs, neuro checkup, and monitor the maintain the fluid and electrolyte balance. So, it's important to remember here. Herpes is the main important thing remember in the patient. Next, we'll go for multiple sclerosis. Multiple sclerosis. Inflammatory disease in the insulting covers of nerve cell in the brain or spinal cord damage. So it's called multiple sclerosis. Okay, it's a chronic, progressive, irreversible damage of central system. Okay, there will be a multiple sclerosis. क्या होता है? You can see the pathology here. Demyelination occur mostly in preventricular white matter में होने वाला है, and then affect your optic nerve and spinal cord and affect the brain. Okay, so demyelination means affect myelin sheath. That will be affect mostly in the preventricular in white matter. That lead to what? Damage your optic nerve, spinal cord, and affect your brain. Now, in this thing, important cause autoimmune disease. But I tell you one thing, there will be important is a faulty one gene is there. एक जीन है उसके होता है, जीन का नाम क्या है? HLA-DR2. HLA-DR2 gene are the responsible genes which can cause multiple sclerosis. Remember, HLR can cause multiple sclerosis. Okay, and deficiency of vitamin D is also can lead to this thing, and abnormal immune response of type 4 hypersensitive reaction. Okay, this also can lead to this thing. So it's not only because of one thing autoimmune disorder, but like pyramidal structure will be here. Okay, one will be our genetic, means we discuss the genes. Second will be our environmental, means a vitamin D deficiency. Okay, and third will be have a type 4 immunity. Okay, problem with the immunity. So this will be like pyramid structure will be here in the patient. Okay, so genetic problem with the abnormal vitamin deficiency and the type 4 abnormal immunity also will be there in the patient. Now, which are the sign and symptom in the patient? Okay, symptom क्या है? Sensory and visual problem with the patient, diplopia, blurred vision, optic neuritis, ophthalmologia, muscular dysfunction, gesture problem, ataxia, then we have hyperplexia, weakness of muscle, and paralysis will be a symptom. Okay, so what do you remember here? Now in this patient will be a same symptom of what discussed, but we discussed some symptom here, the ataxia. Now what is ataxia? Ataxia will be impaired balance on coordination will be there. Okay, because of damage of brain and nerve. So will be ataxia, the symptom will be different, will be discussed here. Diplopia will discuss, blood vision will be there. Okay, all symptoms will be present in the patient. Now there are some type also in multiple sclerosis, but we are not doing in detail. Okay, we have RRB, MS, PPMS, SQMS. We are not doing in detail. Now apart from that, patient have fatigue, weakness, and will be have symptom. Most common symptom will ask in question. Okay, most common symptom multiple sclerosis, remember diplopia. Okay, is common symptom diplopia. Okay, is a most common symptom. Apart from that, how will diagnose? Diagnosis will be done by history taking, physical examination, in CSF analysis will be IgG will increase, blood test and PET scan will be done for the patient. In management, will go for corticosteroid, obviously methyl prednisone drug will be given to patient. Will give the muscle relaxation to give to patients. All drug will be given to the patient, and this are require high fiber diet give to the patient. Okay, it's about the multiple sclerosis. Next topic is very important thing. Increase ICP. Increase ICP. Intracameral increases. So what is meaning of that? So we have some pressure pressure is there in our body, in our brain, which will be maintaining supply of the brain will be properly. So if pressure will be increased, we will call increase ICP. Okay. Now we should make sure what is increase ICP, because it's a very important symptom. Ideally, you need to take very early topic, but I am taking last because in ending, because I want to explain properly in ICP. Because normal ICP कितना होता है? मैंने बात की थी 0 to 4, but 0 to 15 also is there. When will be what is more than 15. Okay, will be our in case ICP. So in case ICP can occur due to any injury, any problem with the patient like tumor, when we have abscess, hemorrhage, edema, hydrocephalus, or inflammation. All this can lead to case ICP. Untreated case ICP can lead to the brain tissue herniation and can be a life-threatening condition to the patient. Okay. Now, how we'll get to know? How we'll understand the symptom? Okay. So there will be have a chance of what? Early sign symptom क्या होता है? Change in LOC, restlessness of confusion, disorientation of lethargy, coma, and vital sign abnormality. You will see the patient. But the main symptom in the NKICP, remember, the main symptom in NKICP is a systolic BP rise without rising a what? Diastolic BP. Okay. Pulse rate abnormal, and respiratory pattern also abnormal is a very important thing in the patient in this condition. Okay. Apart from that, will be have a stroke symptom behind the patient. Okay. So these are some symptoms we have in case ICP. But remember, in case ICP, one thing you have to understand. In case ICP, one special symptom. Okay. Now in exam they ask question, which is the main sign of increased ICP. Remember, systolic BP is rise without rising the BP, without rising the diastolic BP. Systolic BP will be increased, but diastolic BP is not increased. Second thing, the pulse rate will be slow, but abnormal respiratory pattern will be here. Okay, and elevated body temperature. The three symptoms will be here: BP increase, pulse rate slow, and elevate the temperature. Okay, elevate temperature. So this will be the main three sign symptom in increased ICP. In case with the main symptom in the patient. So how will remember? This is the symptom is very danger. Will be have different thing. Okay. So this will be called Cushing triad. So क्या बोलते हैं हम? Cushing triad. Widening of pulse pressure. Okay. Then pulse will be slow, respiration will be slow, and change in temperature. So rising systolic pressure, declining diastolic pressure, regular respiration, and bradycardia. The symptom all together is called Cushing triad. So these are the, remember the word. Cushing triad will be the word will be in the NKICP. Okay. Next thing, how to manage. How to manage? Obviously, first thing we have to maintain, manage the airway. Manage the airway. So maintain airway the patient with heavy ventilation. Hyperventilate the client with 100% O2 supply with suctioning. Fluid restriction. Posture will be given 30 to 45 degree, and avoid excessive coughing to the patient. Sneezing, vomiting, all things will be avoid because it can lead to increased ICP. Okay, so in exam ask question, which are things can be avoided with the patient with increased ICP? So coughing, sneezing, vomiting, and constipation. Now constipation is not done by this thing, so we need to give proper drugs. Okay, fiber diet to give the patient, so patient will not have constipation, so will not lead to increased ICP. So for that, important drug is a mannitol. We will give the hypoosmotic drug is a mannitol drug will be required. Corticosteroid diuretic also can require, anticonvulsant drug required, but the drug of choice of NKICP is a mannitol. Okay, we want to this thing. So NKICP में करना है आपको normal क्या करना है, and Cushing triad and our thing remember, and mannitol is the drug of the choice. Next thing, we come to the Alzheimer's disease. Alzheimer's disease is also important topic. Okay, Alzheimer's disease in this thing, sorry, yeah, is a progressive, irreversible, degenerative neurological disease that beginning the insertly and characterized by the gradual loss of cognitive function and disturbance in the behavior in the affected. So see, first recently discussed will be irreversible damage. एक बार damage होने के बाद will be not recover. Okay, one time will be a affected, will be not recover. अब loss क्या होता है? The loss of cognitive function are affected. So patient will be not able to remember how to do brush, how to do eat food. All things will be forgotten by the patient. Okay, so it's a very difficult symptom. There is some stage early, intermediate, and end stage. In early stage, the recent memory loss. Okay, personality changes, difficulty in the fine word and mood will be in the patient in the early stage. Intermediate, the symptom will be worse now. There will be a past, you have to remember, wondering about this thing, agitation, hostility will be have, incontinence will be feel, and disorient the place for some time. In stage, totally memory loss. No anything remember. Total incontinence. Recently, memory is not there. Memory is not there, and unable to walk, eat food will be out the end stage. So there will be very difficult symptom. Is a progressive irreversible damage of the our neurological area. Okay, and because this thing, the cognitive function are affected. So in early stage, the memory loss will start with the early symptom, and then the symptom will be increased. In classification, early Alzheimer's disease will be have less than 10% of AD cases. Okay, in late stage will be have the most common type AD. So the patient we are not able to understand what will be have. So we'll see only memory loss will be there, so difficulty is there. Now what are the causes? Increasing age will be the lead to cause to the Alzheimer's disease. So higher age can be this thing have vascular abnormalities, genetic factors, change in the this second cardiac rhythm or cardiac abnormality will be have. Stress hormone and seizure disorder also can lead to Alzheimer's disease. Now, what are the symptoms? Forgetfulness. Patient will be forgetfulness will be a symptom. Memory loss. Conversation will be a remember, not remember. Then will be a difficulty in cognitive impairment, personality changes, and dysphagia. So, important to remember is a इसमें आता है कि which are the first sign of the patient with Alzheimer's disease? Memory loss. How will diagnose? We'll go for mini mental status examination. Like you ask patient, person, where are you? All this thing, ask this thing. So we're not able to understand. Health history, EEG, CT scan, MRI, and lab test also done for patient. And treatment require cognitive symptom we can give. Otherwise, no symptom will be not treatment will be provided because of irreversible damage. So it's about Alzheimer's disease. Next thing is a head trauma or head injury. Any trauma to the skull or a skull is called head trauma. Okay, there will be two types, primary and secondary. Primary will be a concussion and contusion. One will be a memory after LOC, one is not after LOC. So concussion will be having after LOC or after LOC effect nahi karega. But symptom will be same and your laceration. Second will be intracranial hemorrhage, any ICP increase, all things lead to secondary brain injury. Now will be what symptom we have affect LOC, increase ICP, seizure, rhinorrhea, otorrhea. What is rhinorrhea? We'll be having CSF discharge. What's your CSF discharge? So rhinorrhea and otorrhea will be important symptom of the patient. Okay, so what is rhinorrhea? Will be having fluid discharge from nasal cavity. Means CSF discharge from the nasal cavity is rhinorrhea, and from ear discharge will be otorrhea. So important symptom. Okay. Then how diagnose will be skull X-ray and CT scan, MRI, and several or angiography. All thing will do. Symptom will be depend where is the location of the injury. Will be manage ICP. Will give monitor to the patient, and we have to monitor the proper ICP to the patient. So will be have stable in the patient. Next topic is a Huntington chorea. Okay, Huntington chorea is important topic. Also is a degenerative disease that lead to death in the brain cell and dementia. Okay, it's a same like Alzheimer's disease, but there are some symptom more. Okay, they have symptom be aware. There will be a 10-15 years will be a onset illness. It's not like symptoms start suddenly. Will be starting. So 10-50 will be a go. Okay, abnormal body movements, frequently emotional problem will be have, and difficulty to swallow food and memory loss also symptom will be have. We have not proper treatment of the patient, so I didn't mention there. Then next topic is a brain abscess. Next is a brain abscess. Okay, collection of the free encephalous pus within the brain is a brain abscess. The most common will be causes will be viral and autoimmune will be causes. Okay, the headache, vomiting, malaise, anorexia are a symptom in the patient. Okay, and obviously, what are the symptoms? What are the causes? On the way we can give the treatment, antibiotic, antiviral, or technique provide symptom treatment provide, and if required, we go for craniotomy and can go for brain drainage. Okay, drainage of the brain also can do this thing. Next thing topic will go for trigeminal neuralgia. This is a disorder of the fifth cranial nerve. हमने बेस पास ही पढ़ा था 7 now पढ़ा था यहाँ पर है 5th cranial nerve affected that lead to sudden attack of severe shooting of pain in one side of face. Patient will be feel pain. See, remember one thing. बेल्स पास में पढ़ा था 7th केनेला इफेक्ट होती है तो पैरालिसिस होता है। जब आपका 5th केनेला इफेक्ट हो जाएगा तो क्या होगा? पेशेंट को पेन होगा, फेस पे होगा, होने वाला फेस में ही है बिकॉज 5th केनेला हो गया। ओके, नाउ दिस इज इंपॉर्टेंट थिंग, क्वेश्चन आस्क्ड इन एग्जाम, व्हिच आर द अटैकिंग ट्रिगर? पीएन के मतलब ट्राइमिनर्जिया के व्हिच आर द ट्रिगर फैक्टर व्हिच कैन लीड टू trigger the factor of the trimetalgia. So any cold, fluid, food, extreme temperature, brushing while taking any food, chewing, touching the face, twisting your face, and tearing, all other can aggravate the factor. Now, our treatment of this thing, we need to give the pain management technique required, teach, avoid triggering factor, and anticoagulant drug can provide. And apart from this, will be required nerve blocking. Also, can give inject the some nerve blocking like alcohol will be give to patient. So, will be have the nerve block will be there. Then apart from that, will be go for rhizotomy, means the root of the trigeminal. जो भी nerve affect कर रही है, उस nerve को cut कर दो. So, not have pain because of continuous pain. So, we'll go for microsurgery, all this thing, and we'll go for radio frequency test, all this thing, and we'll cut the rhizotomy also can done. Okay, so remember the 5th kilo affected, and remember trigger factor and rhizotomy is the important thing in this slide. Okay, so this is about our neurological disorders. Now come to the question. Okay, now a question, they ask question like, which of the following score are indicated for coma in adult patient as per GCS? Which of the following score indicate coma in adult patient as per GCS? 0, 5, 9 or 10? So 0, 5, 9 and 10. So you have to remember, so 12. 0, 5, 9 or 12. So what will be answer? Obviously 0 होगा ही नहीं हमारा. Okay, then more than 8 will be a moderate GCS problem. So we can say less than 9 means only we have one option, 5. So 5 will be the answer. Now next, which of the following activities increase in by sympathetic nervous system? Heart rate, secretion of digestive juice, secretion of saliva, or all of the above? Okay, for the repeated question, which of the following activity increase in sympathetic nervous system? Heart rate, secretion of digestive juice, secretion of saliva, and all of these things. So I think you maybe know this thing, the digestive will not directly affect the sympathetic nervous system. So only one answer is a heart rate. Next question, number of spinal nerve: 28 pair, 30 pair, 31 pair, 33 pair. Number of spinal nerve will be 28 pair, 31 pair, 30 pair, yeah, 33 pair. So I hope I told you in also 31 pair. All are the following neurotransmitter except dopamine, GABA, serotonin, troponin. One is the question. All of the following are neurotransmitter except dopamine, GABA, serotonin, or troponin. So I hope you know the answer because we'll discuss in cardiac also. Troponin will be the cardiac enzyme, so it's not there. Okay, so all are dopamine, GABA, serotonin are the neurotransmitter हैं. उसके अलावा बाकी ये कोई भी ट्रांसमीटर नहीं है. Next question we'll see. Patient Parkinson disease cause deficiency of what? Parkinson disease will be caused by deficiency of which thing? Acetylcholine, dopamine, GABA, या serotonin? I told in exam, I explained also कि Parkinson disease will be caused because of dopamine. Answer will be the dopamine will be the answer. Next question. A 23-year-old client admitted with a tonic-clonic seizure. Nurse know the most common cause of tonic seizure will be stroke, electrical imbalance, head trauma, or congenital defect in the brain. So obviously, electrical imbalance will not cause seizure. Head injury can lead to the seizure. Stroke cannot lead to seizure. and congenital brain deformation of disease. So answer क्या है इसका? Head injury. So head injury is the answer of this thing. Okay. Next thing. Which of the following investigation will be done for detecting the seizure? CT scan, EEG, MRI, or X-ray? Will be done for EEG. Okay. I didn't discuss seizure, but I hope this is a very important topic also in exam purpose. Okay. Seizure will be asked in exam. So I'm covering the question also in the seizure. Okay. Next thing. Inability to speak or understand the spoken word known as a agnosia, aphasia, aphorexia, and insomnia. Inability to speak means is a what we have aphasia. Remember the aphasia. Okay. Fever, headache, and nuclear rigidity is a classical sign of which? Fever. Remember symptom. Remember fever, headache, and nuclear rigidity. मतलब neck stiffness. Okay. Symptom of which disease condition? Alzheimer, brain abscess, meningitis, या Parkinson disease. I explained meningitis. I told you कि nuclear rigidity, neck stiffness will be have in this patient. So it will be a answer is meningitis. Okay. So it's all about nervous systems. I hope you understood everything. Thank you.
Thank you, sir. Thank you, students. Link will be shared to you shortly. You can leave. Thank you.
Okay, they can leave it.
Yeah.
देखिए विधि.
हाँ जी सर. Okay. Thank you, sir.